Welcome to another Wealth Guide IQ video. Here at Wealth Guide, we help connect people with financial advisors that we believe are both trustworthy and capable. In today's video, we're going to be covering Medicare Part B. We have a separate video on Medicare Part A. As we mentioned in that video, Medicare has multiple parts. This particular video only covers Part B, and we're going to be covering three specific aspects, which are enrollment, cost, and coverage. So without further ado, let's dive in. Okay, so first things first, what is Medicare Part B? As you can see, Medicare Part B covers physician services, outpatient hospital services, certain home health services, and purchases of things like durable medical equipment. Now, outpatient services, for those that don't know, that is when you are admitted and discharged from the hospital on the same day. So you don't have any overnight stays and you're not paying for food and lodging. This is most medical events that people experience in their life where you're in and out of the hospital on the same day. You break your leg, you fall and injure yourself, whatever it may be. Those are generally going to be covered under Medicare Part B. So let's start with the cost. The cost of Medicare Part B is a little bit more complicated than Medicare Part A. Part A was free for 99% of the plan participants. Medicare Part B is not. As you can see, the standard monthly premium for Medicare Part B is $174.70 in 2024. So that is where everyone basically starts, and you pay this monthly per individual to be enrolled in Medicare Part B. Now that amount is what 92% of plan participants pay, but there are 8% of the plan participants that are considered high income earners, even those in retirement, and end up paying more. You can see here that there's a table that adjusts your monthly premium based on your income level. So this table here, the first column are for individuals that are single and filing their taxes single. The second column is for those who are filing their taxes jointly. So for a single filer earning less than $103,000, you're going to pay that $174.70 per month. If you earn over $103,000 as a single filer, but less than $129,000, you're going to have what's called an income-related monthly adjustment amount. This is also known as IRMMA or an IRMMA surcharge. So if you go over $103,000, you're going to pay an IRMMA surcharge of $69.90 for a total payment here of $244.60. Now, this IRMMA surcharge is what's known as a cliff, meaning if you earn $102,999 or even $103,000, you're going to pay $174.70. If you earn $1 more, so $103,001, you're going to hit this cliff and you're going to pay $69.90 every month, which is almost $840 per year because your income went over that by $1. Anytime you're dealing with a cliff like this that has very substantial difference in payments, you want to be really thoughtful about how you manage your income. Now, a good financial advisor should be aware of these IRMMA surcharges, and they should be able to position your investments in different types of investment accounts and different types of investments in order to make sure that you don't hit these different IRMMA surcharge brackets. Now, there are instances where you may have investable assets that it's not possible to avoid IRMMA surcharges. But in general, for most retirees, a good financial advisor is going to be aware of these income thresholds and can generally position your investments in a way to avoid them while still maximizing investment returns for your specific goals and objectives. So this is the cost of Medicare Part B. Next up, we will talk about enrollment. Enrollment is very similar to Medicare Part A. There are 3 times in which you can enroll. The first is the initial enrollment period. That begins 3 months prior to turning 65. It includes the month that you turn 65, and then 3 months after you turn 65. So that's a total of 7 months. For Medicare Part B, it may or may not be advantageous to enroll during the initial enrollment period. It largely depends on if you are covered under an employer plan. If you're still working when you become Medicare eligible, it may make sense for you to stay on your employer plan and miss or skip the initial enrollment period. If you are retired, it generally makes sense to just enroll in the initial enrollment period, particularly to avoid any penalties. If you are employed, there's a good chance that you'll skip the enrollment period and you're going to want to use the special enrollment period. You will not pay a penalty for that if you're covered under an employer plan. For employed individuals, this special enrollment period begins basically when you stop your health insurance coverage or you quit your job, whichever's first, and then it lasts for 8 months after that. You're going to want to enroll during the special enrollment period if you skipped the initial enrollment period. For employed individuals, that generally makes sense, so you're not paying Plan B Medicare premiums and your employer Medicare premiums. Your medical premiums for your employer. So the special enrollment period generally makes sense for people that are still employed. And again, you have 8 months after your employment or coverage ends, whichever one of those two is first. You want to try to enroll during the initial or special enrollment period. If you miss both, there is a general enrollment period where you can sign up between January 1st and March 31st each year. It's called the general enrollment period. However, there is the possibility that you're going to pay a penalty for missing the initial enrollment period and the special enrollment period. So the general enrollment period is something that you're only going to do if you've missed these two, and there's a potential you may pay a penalty for that. So that covers enrollment. Next up, let's talk about coverage and out-of-pocket costs. For most people under Medicare Part B, your costs are going to fall into two categories. The first is your deductible. The deductible for Medicare Part B is set at $240 for the year 2024. This generally goes up on an annual basis. You're going to pay the full amount of any medical expenses for the first $240. That's what the deductible means. The second category is known as coinsurance. Now, this is the one that can get quite expensive under Medicare Part B and could be a valuable reason to consider supplemental health insurance plans. After you pay your deductible, Medicare kicks in and they're going to pay 80% of any additional expenses that you have for any qualifying events. The remaining 20%, you're going to pay out of pocket. And for that reason, it generally may make sense for you to look at a supplemental plan so that you don't have to pay this 20% coinsurance. What we're going to do next is take a look at our Medicare Part B our Medicare Part B calculator for outpatient hospital care. What we have here is a calculator that would show you your out-of-pocket costs if you're under Medicare Part B without a supplemental policy. So this first table here has some estimated costs for different types of medical services you may receive. This table's for informational purposes only. The actual cost of these services varies wildly across the United States, depending on variables like geography, which hospitals you go to, and many, many other factors. But this is a valuable table for looking at what your out-of-pocket costs would be under certain situations, just to give you a ballpark idea of the quality of Medicare Part B coverage and why a supplemental policy may be valuable. So you can see here, if you have a broken arm that requires surgery, the average cost in the United States without insurance is $22,000. We're going to use that one as an example to show how much you would pay during that medical event. So what we're looking at here is our out-of-pocket cost calculator. On the right-hand side, we have a graph with this bar chart here. It shows what you pay out of pocket for a certain medical event, and then it shows what Medicare is going to pay. The first thing you have to do is whether or not you're responsible for paying the deductible. In general, the answer to that is yes. And then the service type. So you can select from any of those that were in the table above, or input a custom dollar amount. When you select the medical event, all that this is doing, we'll do the broken arm example that was $22,000. This is just going to input the cost without insurance. So you can see here, in the event that you broke your arm and you had a $22,000 bill, even with Medicare Part B, you would end up paying $4,592 out of pocket, and Medicare would pick up the rest. This number right here on what you pay is the $240 deductible plus 20% of the remaining total bill, Medicare covering the rest. As you can see, this is a very expensive medical event, even with Medicare Part B coverage. If we take a look at something like heart bypass surgery, which retirees do have from time to time, the cost without insurance, it varies very widely in the US, but that can be a $123,000 operation on average. You can see that's a $24,792 out of pocket for you in the event you need this surgery. Heart bypass surgery, depending on where you're located, can actually go upwards of almost $250,000 without insurance, meaning even with Medicare Part B, you'd be on the hook for about $50,192. So as you can see, Medicare Part B is pretty good coverage. It picks up 80% of any of your medical bills once you pay the deductible, but that 20% coinsurance, depending on the medical event you have, can still be substantial. And for that reason, it may be advantageous to look at a supplemental insurance policy that picks up this 20% coinsurance. So that's it for our video on Medicare Part B. If you're an individual and you're interested in getting paired with a financial advisor that we believe is both trustworthy and capable, go to WealthGuideIQ.com and fill out the free consultation form. Until next time, thanks.